All right, guys, now I'm going to talk to you about a little something called Texas Judge Strikes Down Federal Rule Targeting Medicare Advantage Overpayments. And this just happened. You can look this up. This one right here is on insurancebusinessmag.com. I think it's on a few different sites. It's just one of the first ones that popped up. But what's happened is there was a lawsuit from CMS, or a charge, that basically was they were trying to audit a lot of plans, and they were making some grand assertions based on limited data sets about the way that Medicare Advantage plans were billing. So they believed that they were overbilling, and there was a lot of fraud associated with it based on kind of taking small limited data sets and expanding them to the entire membership. So the judge decided that that was an overreach, and they didn't properly audit enough to actually be able to bring this charge out there. So it has been struck down. Now, right here it says CMS has long argued that Medicare Advantage plans generate substantial overbilling compared to traditional Medicare's fee-for-service model, estimating more than $10 billion in excess payments. I would argue that bureaucracy is wholly unequipped typically to be able to audit itself, so that it doesn't really, there's not a lot of claims denials. There's not a lot of risk adjustments and risk scores involved in traditional fee-for-service Medicare. So overbilling wouldn't be a thing with them. They just kind of authorize everything, right? So everything looks good because we paid it and it was approved. But on the other side, we're dealing with the fact that there is more of that claims denials, prior authorization, and then risk score adjustments or risk adjustments based on people's diagnostic codes, et cetera. And so it creates a more confusing process. It creates a process where you have the government and the carrier talking together about this stuff. And so that's just more moving parts. So I don't really think it's fair necessarily for CMS to make this argument, because I don't think that they adequately have the information at hand. What would make more sense is to find out per head what costs more, someone on traditional Medicare or someone on Medicare Advantage, just straight up, like which one costs more. Does it cost me this much on a Medicare Advantage plan and this much on a traditional Medicare fee-for-service head? That would be more adequate. And then if it was costing more Medicare Advantage, then of course the funding mechanism should change to offset that, because the whole purpose of Medicare Advantage should be to try to be more efficient. It should be for better health outcomes, and hopefully to do that more affordably. Now, that's been kind of an argument, is Medicare Advantage designed for better health outcomes, and thus the health outcomes would lower healthcare expenditures? And at this time, if healthcare costs are rising, it's kind of a moving target right now. So the regulators have their work cut out for them to even make these cases while healthcare expenses are going up so fast. So anyway, this is a great article, though. This is probably a win for our industry right now, because the carriers have been under extreme pressure in relation to this sort of thing, and other things, other regulation, et cetera. So I am an advocate for this kind of going away, because we need the carriers to have a win so that their funding can come back around and we can start to see the market tick back in the right direction. Hopefully not into the hyper-speed growth we saw before that led to a lot of the regulatory overreach, but definitely want to start going and trending into a gradual, healthy growth direction versus this kind of bear market we're seeing with the healthcare. So hope that this is helpful information to you guys. If you'd like to see this article, you can comment below and we'll send you the link.